The biggest fraud, the second Spanish flu myth. We've seen how the overestimation of the hospitalization rate at 20% of the population caused authorities to panic and move hospital patients to care homes. And this had a direct result in terms of COVID deaths, which from care homes were 50% of all COVID mortality globally. Hospitals were also at the epicenter of infection. Better management of the infection rate in hospitals and care homes would go on to significantly reduce mortality rate. This did not require lockdown. But authorities doubled down on the Spanish flu myth. Government and media intentionally misled about the fact that the median age for mortality was actually 82. Moreover, those at risk of dying from COVID had existing health issues. Even healthy over 80-year-olds had a fairly limited statistical risk of dying from COVID. And in fact, studies would show that over 95% of patient populations that died from COVID would have serious illnesses already. So this was the complete opposite of Spanish flu in terms of lives lost to predicted mortality. Spanish flu cut off young people in their prime. Spanish flu resulted in significant loss of lives to predicted average mortality. COVID needs to be put in context, and as we can see here, the statistical risk amongst most of the population in terms of age of dying from COVID was actually less than, for example, a normal flu year, of dying in a road accident, or dying from homicide. And I think people found it difficult to talk about mortality, difficult to talk about the risk. And one, of course, the lessons of COVID is to be able to put mortality risk into greater overall perspective.